Good morning. I'm Dr. Morton, and I'm Director of Bariatric Surgery here at Stanford. And I'm going to talk to you a little bit about some changes in your diet after surgery. And these changes that occur are true of pretty much any bariatric surgery, but predominantly gastric bypass. The biggest change that's going to occur after surgery is going to be your portion size. And an appropriate size portion is about the size of the palm of your hand. One good way of sticking to that, instead of eating off a big plate, is to eat off a small plate, like a salad plate. Same thing with spoons and forks. That's the best way of keeping to that small portion size. And that's going to be the biggest change that you see. The other thing that's important in addition to how much you eat is when to eat. And because you're not eating as much because of those portion sizes, you're going to have to eat a lot more frequently. So instead of maybe 2 big meals in a day, what you ought to shoot for is at least 4 to 6 small meals in a day. And I'd say it's as simple as 4 by 4. 4 small meals about 4 hours apart. And you really don't want to go beyond 4 hours without eating, because the food you eat will not last longer than 4 hours. You're just not eating enough. So it's important that you eat more frequently. A couple of other things about eating, how to eat. I think we all know how to eat, but there are some better ways than others. And a couple of things to kind of keep in mind is to chew. It's very important you chew at least 20 times before you swallow. And if you do that, it's naturally going to take about 30 minutes. If you eat too much or if you eat too quickly, that's when you can get into trouble with food coming back up. Patients have told me, if you don't chew, you will spew. So it's important to be careful with your chewing when it comes to that. So we've talked about how much to eat, when to eat, how to eat. How about what to eat? And I think the key consideration there is protein. Protein first. And you want to get at least 60 to 80 grams of protein in each and every day. And protein is a great food source for a variety of reasons. For one thing, it lasts longer. When you eat that protein, it'll last longer throughout the day. You all can tell the difference if you have eggs for breakfast versus having a donut for breakfast. If you have a donut for breakfast, by the time 10 o'clock comes, you're crashing. And part of the reason that you're feeling weak and tired is if you look at what happens to your blood sugar, it goes straight up and straight down like a roller coaster when it comes to that sugar content in things like donuts and carbohydrates. Now, protein is a nice smooth ride. It stays fairly level all the way through. And it's really, people think that it's those big shifts in blood sugar that can cause people to feel hungry and make you eat more over time. So it's important to have that protein first, real critical. Now, in the beginning, the first 3-6 months after surgery, you want to be careful with red meat, raw vegetables, and breads. Now, red meat, raw vegetables, those make a lot of sense. They're kind of tough, and it's hard for that to kind of go through. But what about breads? What's wrong about breads? Well, breads can act like a sponge, and so you eat that bread, and it can swell up. And when it swells up, it can act as a very effective plug. So you got to be very careful with the breads. The other thing about breads is, plain and simple, they're not great for you from a diet standpoint. If you think about it this way, bread doesn't grow on trees. We weren't meant to have it on a daily basis. And so that's why you have to be careful with breads. Now, and when I say breads, I'm also talking about other carbohydrates, things like bagels, pasta, rice, tortilla. All those things count as breads, if you will. Now, if you're going to make a bread choice, you can make a better choice than others. So generally, the darker the bread, the better. So whole wheat is always better than white bread. That's always good. Tortillas, if you get a tortilla, it's better to get a corn tortilla instead of a flour tortilla. And part of it has to do with it slows down the absorption of that sugar. Remember the sugar going straight up and straight back down? If you add a little fiber to your diet, it's going to slow down the absorption. And that's what whole wheat does, and that's what corn does. So that's something to kind of keep in mind. Believe it or not, if you toast your bread, that also helps slow down the absorption. So those are some other little things to think about. Other things about what to eat, things that are on the no-no list, are ice cream, milkshakes, and sodas. The first two make a lot of sense because they're high-calorie liquid foods. No matter what I do at the time of surgery, if you have these foods, you may regain some weight. So it's important to avoid them. Now, they're high in sugar, so some patients may get dumping. And dumping is as bad as it sounds. If you eat foods that are high in sugar, high in fat, you'll feel lightheaded, kind of sweaty. Feels like the worst cold of your life. And what happens there is that those foods that are high in sugar set it off. But not everybody gets dumping. So you may or may not be able to tolerate this ice cream milkshakes. But it's important not to have them. I would say be very careful. It's a slippery slope. I personally like Ben & Jerry's ice cream, and I'll say like I'm going to eat just a little bit of it, and before I know it, it's in the trash can. So you have to be careful with milkshake and ice creams. The other thing to talk about are sodas, and you got to be careful with sodas, even diet sodas. For one thing, when we make your brand new stomach, it's quite small, and you can imagine if you've ever drunk a Coke kind of quickly and felt you had a burp, it feels uncomfortable, right? And imagine what it's like when your stomach's about the size of my thumb. It's going to feel very uncomfortable. So that's one reason. The other reason is sodas are plain bad for you. If you don't believe me, get a shiny new penny, put it in a can of Coke, come back 2 or 3 days later, that penny won't be so shiny anymore, and that's what goes inside of you. The other thing is most of my patients, about 82% of my patients are female, and I think you can see that in the room today, that most of my patients are female. And you all need to have calcium to have strong bones so you don't get osteoporosis later in life. Well, some people believe that those sodas actually interfere with some of your calcium metabolism. It's high in phosphorus that can interfere with the calcium you all need to have strong bones. Now, there's actually a study that showed that even if you have diet sodas, you can gain weight. You may wonder, how do you gain weight with a diet soda? Well, what appears to happen is when you drink that soda, it kind of changes your sensation of taste, and you start to anticipate other foods. And I'm pleased to see that all around the table all we got is water, which is good, because water is really the best thing for you to have. And you should really have about 12 ounces of water on a daily basis before you leave the hospital. Meg comes around and brings you a very fancy, good-looking water bottle. It's got the Stanford colors, Stanford logo on there. It's a thing of beauty. So Meg designed that, and we're all proud of it. It looks like a rocket ship, and it's a rocket ship taking off for you guys, because if you take these fluids, it's going to help you out in a lot of ways. Number one, you need it to stay hydrated. If you're not hydrated, you're going to feel tired, okay? People sometimes feel tired after surgery, and they ask why. Well, sometimes it's a blood count, may be low. That's rare. Sometimes you're not getting enough protein in. That's one other reason. But the other reason is if you're not drinking enough. So it's important to stay hydrated. You should be drinking at least once on every hour. And I know it's hard, because right now, if you want to, you can get a big glass of water, drink it straight down, no problems at all. Problem is, after we make that little stomach, it's not so easy to get that water down anymore. And it's a job. You have to sip on water pretty much all day long. But if you drink that water, it accomplishes a few goals. You stay hydrated. It's good for your skin. It's good to stay regular. And the other thing it does, it keeps you from eating too much. It's called water loading. So if you have some water, a few minutes before you eat, it'll keep you from eating too much. Now, you want to be careful about mixing liquids and solids immediately before eating, so just be careful with that. But remember, try to stay hydrated. The last point I want to make is a very important point when it comes after gastric bypass surgery or any of the weight loss surgeries. And that is, you have to take your vitamins. You have to take your vitamins each and every day for the rest of your life. And I think it's important for anybody who's undergoing weight loss, because you're not eating the same and you're not getting the same amount of vitamins as you did before. For bypass patients, you have to take a B12 and a multivitamin on a daily basis. Some of our patients may need iron, some may need calcium. And I'm not going to rely on just wishing and hoping that you took your vitamins. I will check. I'm going to check at 3 months, 6 months, and a year. And then we'll check once a year for the rest of your life. This is important for me to know that you all are doing well. And that checkup beyond a year is also help coordinate your care a little bit, because not everybody, not every doctor knows a lot about weight loss surgery. And so I can kind of help out in that area talking to other doctors. So these were the main things I wanted to cover when it came to diet: how much to eat, when to eat, how to eat, what to eat, your fluids and your vitamins. Any questions you all have about the diet before I go on to talk how the operation works? Feel free to ask. Covered everything? I'm that good. I covered everything. All right.
She's that good. She covered
All right. Meg is that good. There we go. She's the best. Okay, so no other questions here? I'm going to go on to just talk about how the operation works. And then we'll go through some of the risks and benefits, and we'll have plenty of time to go through things one-on-one. Got to make sure you're getting my good side there. Okay. What we're doing here is showing you how the operation works. and it's pretty straightforward. What I do is I create a brand new little stomach right here, and it's literally about the size of my thumb, quite small. And we physically separate it from that big stomach. The other thing we do is we divide the small intestine, and we bring one portion up to that little stomach. And the way you lose weight are two ways. One is you can't eat a whole lot because that stomach is so small. The other thing is you don't lose weight because between here and here, food is not absorbed. You need the juices from this part of the intestine to start that digestive process. So it works on two different levels. I have 3 goals at the time of surgery. My number 1 goal is your safety, number 1, okay? My number 2 goal is to give you this anatomy so you can lose weight. And the third goal is to do it with the small incisions. And it's kind of in that order. So any point in time it doesn't appear to be safe, I won't hesitate to make that larger incision. That being said, I've done at this point over 900 cases, and I've had to go from little incision to big incision about 6 times. So it's relatively rare. Okay. Any questions about how the operation works? No. Well, let me go ahead and go on to some of the risk and benefits, and we'll talk about the good stuff first, the benefits. And the obvious benefit, number 1, is weight loss. So imagine if you happen to weigh 250 pounds and you ought to weigh 150. That means you have an extra 100 pounds. Of those extra 100 pounds, you can expect to lose about 75%, or in this case, 75 pounds. When you lose that weight, you also lose some of those medical problems that you carry when you have extra weight. Things like diabetes. I'll show you in 1 second here. So we get rid of some of these medical problems, things like diabetes, high blood pressure, sleep apnea, reflux, and the acid reflux, and joint problems. So with the bypass and with all the other weight loss surgeries, you get good resolution of these medical problems. With diabetes, it's a cure, no medicines 82% of the time. For high blood pressure, it's about 70%. For sleep apnea, similarly good results, no CPAP, about 80% of the time. Reflux, it's exceptional. We cure that about 95% of the time. Very, very good operation for reflux disease. Joint problems, not so good, only about 60%. The reason for that is some damage has already been done to those joints, and I can't reverse that. But what I can do is get some of that weight off that allows you to exercise more. And when you're able to exercise more, it keeps those joints in good health. So when we get rid of the weight loss, when we get rid of the weight, some of those medical problems, we're also increasing your lifespan. Okay, there have been several studies now. There's probably at least half a dozen, from everywhere from Utah to Canada to Sweden, that have shown if you have this surgery versus not having it, it tends to increase your lifespan on the order of 7 to 10 years. So in addition to increasing the quantity of your life, the other thing that happens is we hope to increase the quality of your life as well. And I think that last point is what my patients are kind of most grateful about. Things like being able to interact with your co-workers, your family members, getting on a plane, not having to worry about the belt extender, an extra seat, being able to sit in a booth in a restaurant, all those things. And they may sound like little things, but life is a series of small things, and it's important. And if we can make a difference in that area, we're happy to do so. So you can see from this operation, there's quite a few very good things that can happen with the operation. But like anything else in life, there are good things, bad things. And, the number 1 bad thing with this operation is death. People can die from this operation. You look around the country, and the mortality rate for a bypass is about 1%. Here at Stanford, and with myself, my mortality rate is 0 of all the patients that I've had opportunity to do weight loss surgery on. If death occurs, it's usually due to 1 or 2 things. The number 1 thing is a leak between the stomach and the intestine. Okay, we take specific efforts to prevent that. We test it before we leave the operating room. I leave a drain next to it that tells me if something's coming out that shouldn't be coming out. I test it the next day after surgery. And our leak rate is very, very low. We haven't had a leak in quite some time, and part of the reason is that we've learned a lot from all the cases we've done. The other thing that can occur after surgery is a blood clot that can go from your legs up into your lungs. We give you massaging stockings at the time of surgery. We give you a blood thinner at the time of surgery. But the most important thing is for you all to get up and walk after surgery. Very, very important. I'm going to go to a lot of effort to do it with the little incisions so you all can get up and walk with more comfort afterwards. So it's very, very important to walk after surgery. There are other medical problems that can occur after surgery, and we go through them in a lot more detail at our informational seminar as well as one-on-one. But a few things to kind of highlight include things like bleeding. Bleeding can occur inside the intestine, and that happens about 1% of the time. We can have bowel obstructions that can occur. There can be ulcers that occur. We give you medication to help prevent that, the Acifex. There can be strictures where this connection between the stomach and the intestine heals too much. If that happens, we can gently dilate that open with the endoscope. The other thing that can occur are problems with your gallbladder. We give you medicines for that as well. Other potential concerns, I think I mentioned, where bowel obstructions can occur down the road. And, of course, the vitamin deficiencies. We want to be very careful with that. If you have trouble keeping your food down, it means you may have trouble keeping your vitamins down. So if you're having trouble keeping your food down beyond a day or so, please give us a call so we can help take care of that. Because there are ways where we can get those vitamins in short of by mouth. The other thing I do want to mention, too, is if you're planning on becoming pregnant, please wait at least 1 year after surgery because you're losing too much weight in that first year after surgery to support both yourself and your child. The other thing is once you do become pregnant, we have some special recommendations for you when it comes to vitamins, and please let us know so we can give you those recommendations and also work with your gynecologist as well. Those were the few things I wanted to kind of go over with you. I know we've gone over this stuff before, informational seminar, the initial consult, Meg's gone over stuff. You've gotten a lot of materials. So I know a lot of the stuff is review, but we do it because I know it's a lot that you have to take in. So, and we're going to get together one-on-one to go over your medications, any questions, concerns you all have, and then we'll get you ready to meet the anesthesiologist upstairs. Okay? Thanks very much.